workforce development here at Ultimate Health Services. And we run a lot of programs here with workforce development, and one of them that I actually take lead on is the East Los Angeles Area Health Education Center, AHEC for short. This is more of an internship opportunity that provides a lot of clinical based learning in terms of virtual and in-person objectives and workshops. So without further ado, I will get started. A little bit that we're going to go over is, apologies, is the Ultimate Health Services history, how we became about California Area Health Education Center as a whole, Ultimate, us, East LA, AHEC, and general contact information if you have any questions. And Ultimate was founded by a group of brown berets and named the East Los Angeles Barrio Free Clinic. We're talking about 1960s. Initially a volunteer staffed storefront operation relying entirely of grants and donations. After everything that transitioned through history of Los Angeles, it became known as Ultimate. Ultimate is now the leading healthcare system providing care for more than over 300,000 Southern California residents. Services that we include here in our clinics include medical, dental, senior care, urgent care, pharmaceutical, HIV services. We are not a hospital, but we have mainly all the services a hospital has. We have over 40 clinics throughout Southern California, and we are continuously growing more east, south, and potentially north within the next couple of years. Now, the vision that we have is to be the leading based teaching health center for current and future health professions. Our mission is to bring scholars from different disciplines, build their talent, and prepare them to join the workforce and achieve positive health outcomes for underrepresented communities. Now, California's statewide AHEC program, there are a lot of AHEC centers within California and without the nation. I had the privilege of actually attending the first AHEC National AHEC conference post COVID, and there are more than 700 AHEC centers throughout the nation. And the beauty of what we have at AHEC was established in 1972, and it was established to recruit, train, and retain health professions workforce that is committed to underserved communities. It brings together local resources, community-based organizations, and academic institutions to improve access to and quality of healthcare for underrepresented populations across the state. The AHEC program also develops a population-based approach to health professions education with a special emphasis on community-based training. Now, what is the mission here specifically with myself and the AHEC Center? It is to improve access to quality care for underserved populations in California through academic community partnerships. The goal of the AHEC Scholars Program in community health is to provide health profession students with a comprehensive experience of working in community health to ultimately encourage them to pursue careers serving rural and or underserved communities. Now, the program overview of what we have here at East LA Center is it mainly follows a hybrid learning approach using both an online learning platform and a monthly virtual workshop based setting that provides scholarships with a comprehensive learning experience in community health as a whole. As set by the California AHEC program offices, AHEC scholars are required to complete a total of 40 hours of didactic online education and 40 hours of community based training per year. This includes more so of internship opportunities that we will provide in our clinics. Our clinics, as mentioned before, range from dental, medical, psychiatric care, PACE. We have almost everything. Scholars, after the completion per year, will receive a stipend of up to $1,500. The requirements, I could go a little bit over for anyone that has any questions at the end. Now, those that are eligible, there are 1 and 2 year programs. So the ones that are eligible for the 1 year program, the main difference between 1 year and 2 year are the amount of assignments that are assigned, essentially. So the 1 year program, the ones that are eligible for that are those that are requiring an LVN, licensed vocational nursing degree, behavioral health, certified nursing assistant, community health worker, medical assistant, and anyone that falls under allied health. Allied health are dental assistants, dental hygienists, medical assistants, health educators, health administration, and health education specialists. Those that are eligible for the 2-year program are anyone that's going into dentistry, medical doctor, MD, DO, etc., nursing, RN, psychology, and the master's level, public health, either at bachelor's degree or post grad, and social work. But other than that, my name again, Juan Placencia. I am the Ultimate AHEC project coordinator. This is our location of where we would host you initially, and my contact information is right here. My email and my phone number. Please feel free to contact me via email or number. I respond faster via phone, but please let me know if you have any questions. And also, I am going to put on the chat uh, one of our websites that we have that resonate what we do here at Ultimate with AHEC.
Thank you so much, Juan, for that. Do any students have any questions? Seems like there's no questions. Someone put in the chat, is there opportunities in the pharmacy field?
Yes, so we do have we have mostly all of our pharmacies in clinic or in house. From that, with the internship opportunity, we will be able to house you there. And also, if there are requirements for your actual school, for example, if you have a practicum that you have to complete, we could also assist you in completing those hours.
Carlos?
Thank you. Thank you for giving this opportunity. Juan, it's nice to see you again. And I'm glad that you're bringing this opportunity more broad this time. And a question that I have is exactly based on what you just said, that many of our programs, for example, medical assistant, dental assistant, CNA, pharmacy tech, they require hours to be completed, in order for you to get the certification, license, etc. So do you know if, for example, if our programs, I have here, one of the leading faculties is Dr. Yervan Bogus from the medical assistant program at West. For example, if we want to bring students, all right, to complete those hours, can they be more than, how will we organize that in order to provide that experience? Because we have approximately 30 students that they need to complete those hours. Are they going to be located in one facility, multiple facilities? That's one of my questions. And the second, many of those programs or our college actually requires for us to have an agreement with I don't know if in this case it will be with Altamed, or I don't know if in this case it will be with the individual locations. How do we do that, Juan? I don't know if you're familiar with that.
Yes. So to answer your first question, we have a lot of clinics that offer these services. So depending on the location of the students, we will try to accommodate the distance, right? So we will try to ensure that one, the clinics aren't full with all these learners, so they would have a more genuine experience with their preceptor. And just location, right? We want to be conscientious. We don't want to put someone that lives in Los Angeles and put them in one of our OC clinics. So just be conscientious on that as for us to be conscientious on that. In terms of the actual agreement or the TIA, teaching assistant agreement, it would be with Ultimate.
Okay.
So that would be established already, and being part of AHEC, we would be able to expedite that with our legal team, etc. The whole logistical part of that, we would be able to expedite that.
Okay, great. And I don't know, I don't want to be dominating the conversation. I don't know if there is any other question that you see.
So far, no questions in the chat.
All right. For example, another program that requires quite a bit of hours is dental hygiene. And this is I don't know if you remember, Juan, I explained to you that West LA right now has a bachelor's in dental hygiene, and students, they need hours. They need a lot of practicum to be completed. Now there is one. I mean, it's something that can be worked out, and perhaps the specifics can we discuss it later on with the director of the program. Lisa Kamibayashi is also here. She's the director of the dental hygiene program. If students are completing, for example, evaluations, our accrediting agencies require that we have to have an instructor with the students at the facility. which can be convenient, for the facilities because you have somebody supervising these students, guiding and all that. But at the same time, some facilities may have issues that, okay, we're gonna have we have to accommodate a minimum. We have to accommodate 5 students plus 1 instructor coming. So I don't know if you have any experience on that, Juan.
We have had situations or circumstances that have been brought up like that. With that, just because of the legalities and
Mhm,
and policy, we would have to meet specifically with the director of dental department
mhm.
and let them. She's already aware. We have one of our AHEC scholars already interning with the dental department.
Excellent.
So she's aware of the program. So it would just have that conversation, letting them know that it's per your institution's curriculum that you have to have a professor there with them or instructor there with them. And we are more than feasible. I know we have done it in the past, so I do not see an issue with that. But it's just to have that conversation to loop them in, and making sure that all the T's are crossed and all the I's are dotted.
Correct. Correct. Yeah, because all the other programs, medical assistant, pharmacy tech, medical assistant, pharmacy tech, dental assistant, they can be actually, you can accommodate 1 student at a time, or you can accommodate 10 students at a time. There is no direct supervision from faculty. Dental hygiene is the one that has a little bit more of a more specific criteria, all right, in which the instructor actually comes with the students. So they can be graded, supervise the quality of the work that is being performed on the students, et cetera, et cetera. So that will be perhaps those specifics can be dealt later on, on a different opportunity.
Yes, and then depending on where the students would need in terms of if they need access to our EMR system, we
Mhm.
would provide them free of charge that training to do all that as well. And
Right.
also in terms of health clearance, because we do have our own protocol of onboarding, I would be in charge of onboarding all of our learners. We have an employee health department that is free of charge for the learners as well. So if they need to get a TDAP, PPD, TB reading, a physical, we cover the cost.
Excellent. And Juan, perhaps not right now, but just to give you something for you to think about it, or hopefully you can provide us, is do you have any list of facilities, of locations where students can go for medical assisting, for pharmacy tech, for dental, for hygiene,
Well,
that
we do have
that it can be provided to us? Sorry.
we do have our general page of ultimate.com and our locations there. But if you would need an actual list, yes, I could more than happy to provide
Beautiful,
that for you. Yes.
beautiful, excellent.
Of all of our locations and services that we provide per location and everything, I could provide that for you.
Excellent. And my understanding is, if, for example, our students, hopefully they will be able to be part of that of this internship at your locations. They are also qualified for that $500 or $1,500.
Yes, as long as they complete the requirements that we have in AHEC, which are the 40 hours of didactic online training, which are module based.
Mhm.
There are 40 hours of clinical research. There are 10 extra hours of community based, which falls into the 40 hours of clinical research or component, and a 2-page write up. As long as they complete all those requirements, they are eligible to receive up to $1,500 in stipend per year of completion. So those that are going into 2 years, they get $3,000 if they complete the 2 years.
Wow, that's good.
Plus the opportunity to intern here at Altamid, get that genuine experience of how we do patient care, and if everything goes well, potentially get hired within the organization. I can't promise a hire, but I could promise that mentorship, that professional development, those trainings that to be ultimate fit to get that opportunity to at least interview.
That's great.
That's the pipeline that I have tried to structure this, at least with this cohort. So as of right now, we have 3 individual learners from the previous year cohort that are interning with us, that are continuing to intern with us. It's a minimum of 40 hours. If they want to do more, they could do more. Than we are more than happy to accommodate for them to do more. If they do not like the placement that they have originally, I'll give my personal story. I originally was going to be an MD. I did my clinical hours at another hospital, and I didn't like it. It wasn't for me, but I went more administration, and that's where my path was led, right? So it's giving them multiple opportunities. If they go into, we have one scholar that is in the HIV department. He didn't like it. I want to go to more of the admin clinical aspect. We connected him with another clinic that focuses more on clinical admin, and he loved it. So
Excellent.
we give multiple opportunities. We were able to we try to accommodate as much our scholars as possible.
Perfect. I think
We
that's
meet them where they're at, and we encourage them to push through that threshold and excel beyond the potential that they believe that they have originally.
great. Lisa, you're front. I don't know if you have any questions on the specific programs.
Uh, Thank you, Carlos, for bringing up medical assisting program. My question is, while students do their hours at your facilities, do they get paid or is it unpaid? That's what my
Thi-
first question.
This would be an unpaid internship. The only
Unpaid.
payment, yes, the only payment that they would receive is after the completion of the program. They would be eligible for $1,500 in stipend.
That's my question, yeah, because
Yes,
it's gonna be payable, that not considered as internship or practical.
correct. We do have another position or other positions through, and it pops up depending on department need, which are project interns. Those are paid interns, but
Yeah.
those are specifically per department needs.
Thank you. Thank you. My second question is our program, as Dr. Sormenio mentioned, that we have two portion, administrative and clinical medical assisting. In the administrative part, usually student, they do the administrative, the front office scheduling, and this. My question is, I don't know, what software do you use in your facilities?
We use
Because,
Epic.
oh, go ahead.
Yeah, sorry, we use Epic.
Oh, Epic?
Yes.
Okay, thank you, because we
And
train
if
our students to use Medisoft.
okay,
For teaching purposes, it's really convenient. It covers, give them idea how to, use it, manipulate it. But different clinics, different offices, medical centers, they use different software. But we prepare our students, we teach them Medisoft, yeah.
yeah,
I-
definitely. I know for another FQ before working for this FQ, we use NextGen in that FQ. So here coming to this organization, we use Epic, and we
Mhm.
provide that training for them depending on the need of what access they have. We give that course to them. If they need to have that course multiple times, we will be more than happy to give them that course
To
multiple
train
times
them, to
free of
show them,
charge.
to explain to
Yes,
them. Great,
yes,
great. Another word, they will have a preceptors, right, at the site
yes,
to,
as well.
oversee them.
So they would come to our offices, or we have
Uh-huh.
an Ultimate University. They would come to our offices here. They would get that one-on-one with the lecturer or the instructor to do the Epic, and then once they're at the clinical site, they would also get more hands-on experience with the preceptor.
I'm sure they're gonna go through orientation as well. Is that correct?
Yes, yes.
Great. My other question, sorry, Lisa, about that, uh, our students, they have to do at least 100 hours per session, let's put it this way. We have uh, two classes, let's put it this way. We call them Health Occupation 59 and Health Occupation 60. And they have to do 100 hours per each. One starts in a winter semester, the second one starts in the summer. If that will be okay with you, if they kind of just come do some 100 hours, leave, then come back in the summer.
100%. We have another AHEC scholar that, based off of their schedule, they were only able to do 3 hours every Monday.
Oh, great,
So it's
great,
having that, and we have established great connections throughout the organization, throughout the clinics, the admins, the directors. So we are able to accommodate that. For us at AHEC, the program, we only require 40 hours like max. That's all we require. If they need
great,
more, we're more than happy to accommodate that.
great. My last question, Lisa, sorry about that. How late your facilities opening? Do you have
We
a
are open.
weekend facility?
We are open 9 to 5, Monday through Friday. The only facilities that are open are urgent care clinics. Those are open on the
Do you have
weekends.
urgent
24/7.
care?
Yes,
Our students are able to do some hours in urgent care.
they would be.
Uh-huh.
They would be depending on the amount of students that we would bring on, and again having that conversation with the clinic admin for that specific site.
Yeah, I'm asking because most of our students are working during the daytime and they come to the class in the evening. That's why, if you have, you allow our students to do some evening hours, that would be really great, or in a weekend.
Yes, we would do that. Now, we also do a pre-vetting process. So everyone that does apply, we interview them as well to see if they are one fit for the program, two if they can have the commitment based off of their schedule, and if they are up for the challenge.
Thank you so much for
Yes.
your, thank you. Sorry about that, Lisa. Thank you so much.
No, no worries. Just one quick question. So I'm looking through this AHEC website right now. This doesn't give us the list of the center locations, does it? For Ultimate?
No, that one is just a general description of a little piece of the cake, if you will, of what we offer at our site.
Okay,
So
no,
I could let me see here. I could give you the specific locations or the where we're actually where you can find all of our locations.
Mm.
I like how my internet is not working when I need it to. But here is the link of. There you go.
okay, got it. I will check
Those
it.
are all of our locations, the services that we have. I was planning to send Dr. Semenya more of an Excel sheet of what we have, but yes, that's
Okay.
more of our general one.
Okay. In general idea, it's like, is dental facilities at all locations or just selected locations?
Selected ones, yes, we are still growing the dental department,
Mhm.
so it is at selective locations at this moment. Yes.
Okay. All right. I'll review your site. Thank you.
Any more questions from students?
Can I ask one more question? Yeah,
Of
sorry
course.
to bother you again. As you know, our medical assistant students, they have a lot of hands-on, task skills, such as, doing vital signs, injections, drawing blood, and so on. And our students will be able to perform those kind of tasks at your facilities? Or what kind of
They
tasks you are going to allow them to do? at your
they
facility?
would depending on the preceptor's discretion. So if the preceptor feels that they are capable of doing that and the trainings that we provide, if they were able to pass that and under the preceptor's discretion, then yes.
Yeah, just to let you know, in case, because there's a minimum requirements in our, program each students must do. They have to perform at least 10 of each shots, intramuscular, subcutaneous, and so on, and 10 of venipuncture or phlebotomy, blood drawing. I mean, they have to practice. Whatever we do at the clinic is completely, at the school, at the college, in the lab is completely different than at the clinic. That's why we send them out there to have some hands-on skills with the patients, to get familiar with the environment, how to speak with the patients, how to deal with them, how to perform vital signs. That's what's my concern.
Yes, it's all under the preceptor's discretion.
Oh,
So we will provide the training for them. And also those that have applied, we go through a pre-vetting process. We interview each and every one of them to ensure that they are ultimate fit, that they are for the mission, and they have the time commitment to complete the program. Not only our programs, but yours as well.
thank you so much.
So we have a question from Katrina. She said, I am a student that has completed the pharmacy tech program. I have done externship hours already as well. Would this internship be a good fit for me?
So one of the two top major requirements is that one, you have to be enrolled in a current program. You have to actually be currently in classes. And the second one is that depending if you're on the 1 year track, you would have to be either your last year of school, or if it's a 1 year program. If you are on the 2 year track, you would have to be on your junior year.
Lisa?
You actually answered my question, but I was thinking about this not enrolled students, but students maybe interested in the field to be exposed to this career, or observing a little bit of help. Is that something you do for?
It is feasible, yes, as long as they are in an academic institution.
Mhm.
And if they are, for example, a dental assistant, or they're looking into dental assistant, I would go with them during the application process as well.
I
So
see.
I would walk them through if they are majoring or in their focus of study is completely different than what they actually want to experience. I
Mhm.
would work with them to ensure that the application meets the qualifications for AHEC department and for what they want.
I see. So enrolled students, right? In, let's say, like, so I have like so many applicants who coming to dental hygiene program, and then we wish they have some experiences, or even observing experience before they come and apply our program. So not technically they're enrolled, or maybe they're enrolled in other colleges. And do you think that is a feasible range, or
In terms of like a shadowing experience,
right, something?
that is feasible, but that would require more of a teaching institute agreement.
Mm, I
Just for
see.
liability purposes and
I
everything, that
see.
would be
I
more
see.
towards that, yes.
Got it.
But
So
if
you
they
want,
are,
okay, more
yeah,
controlled, more
yeah,
organized. Okay.
preferably if they are enrolled in a dental program,
Mm-hmm.
we vet them through the application process,
Mm-hmm.
and then we would give them that experience.
Got it. Okay, thank you.
Cody, do you have a question?
Oh, my name is Cody White.
Do you have a question?
Yes, it's about the it's about the HEC easier information of the healthcare. We talk about healthcare is the care is about medical is is assistance.
Yeah, it is based on auto care, but do you have a question about the program?
Yes,
Okay, what's your question?
I have the question. Which is thinking of, oh, you should have thinking about the assistance.
Okay, what's your question?
Medical assistance about the take care of take care of the hospital, the medical. It's a healthcare.
You keep cutting off your thing, so if you could just type your question on the chat box, I'll go ahead and read it, okay?
What is it? What is we have at the point?
Does anyone else have a question?
This has been very helpful, Juan, and I think for our interests, we probably will take the conversation, on a different day, perhaps, and contact you, because we really need to start talking about the contract agreement and how can we move forward to give this opportunity to our students as soon as possible.
Of course, Dr. Sermon, from my understanding, the agreement is already underway. I know that was an update from my supervisor, so I think we're just waiting on the legalities aspect. But we should. I mentioned it to her as well, just for this meeting and a presentation. And if there is a need, or if there are a lot of scholars that want to be take part of it, we have already expedited that process. So we are more than happy to establish this collaboration and make it long going if possible.
Excellent, even better. You're ahead of me then, Juan. Thank you.
I got you, doctor. I got you.
I hope medical assistant is included in the agreement.
Yes, it's gonna be all healthcare
All the
based.
program.
Yes, we got you
Great.
too.
Thank you. Yeah. What do you think, how soon they can start doing that?
So our applications open, well, they're actually open all year round. What I would like first is to have them meet me virtually. I could run them through the application. I put my contact in the chat as
Mhm.
well, and I know the career center also has my information. Run them through, show them every. I if I would go through the logistics of everything that's in detail of the program, it would take me a couple hours, and this was just more of an information session. So I would walk them through, ensure that their time permits it, their feasibility, see who they are, their mission, the why as to why they took this career. And to answer your question, once they are officially admitted into the program, they could start day 2 on training to get the EPIC training, the EMR training, and hopefully within the next couple of weeks, they are in clinic.
How about before the externship or practical classes start, can we invite you to come and speak to the class and introduce yourself, introduce about the program, and let them know what the requirements are, even about the month prior the classes start? How about that? Is that
100%.
possible?
I would be more than happy to.
Oh, great.
Yes,
Thank you
let me
so
know the
much.
time and I'll try to accommodate your schedule.
That would be great.
We also have multiple other programs that we have here at Ultimate.
That would be
So
great.
it would be a more. I would bring my whole team just to ensure that
Would
everyone
be
was
happy to
aware.
have you in the
Thank you.
classroom.
Thank you.
Thank you.
Thank you so much, Juan. If there's no other questions, we could wrap our meeting up early.
Thank you so much for facilitating this conversation. I didn't get your name though.
My name is Jose. I'm one of the
Jose.
interns here at the
Perfect.
Career Center.
Perfect. Thank you, Jose. Thank you, Juan. We really
Yeah,
appreciate
thank you,
you.
Juan. Thank you, Jose. That was really
Thank you. Thank you for the invitation. I hope to speak